All right. Greetings and thank you for joining. This is Public Health Virtual Mini Fair. I'm Nick Mahoney, Director of Student and Alumni Engagement. Throughout this presentation, you'll be able to ask Q&As using the Q&A feature. You can just click on the Q&A feature and you can ask questions in writing throughout the meeting. Simply just click on it and our panelists will be able to answer them as they are able to. We will have some time at the end of the formal presentations for a general Q&A, and we will try to answer as many questions as we can. Throughout your time in this session, we ask that you stay muted with your video off during the formal presentations, and you can also change the view of how you see our presenters by clicking on Hide Non-Video Participants and selecting Speaker View. After the formal presentations, you'll be able to meet with our exhibitors in breakout rooms for an hour. Our presenters today are the Brown University School of Public Health, CUNY Graduate School of Public Health and Health Policy, Kent State University College of Public Health, Tulane University School of Public Health and Tropical Medicine, University of Illinois at Chicago School of Public Health, University of Kentucky College of Public Health, and University of Nebraska Medical Center College of Public Health. And our first presenter is Brown University, and we welcome you today.
Thank you so much, Nick. Welcome everyone to these mini fairs. I'm super stoked to be joined here with my friends and colleagues across these amazing universities. So I've got 5 minutes. I'm setting my timer right now, and I am going to jump right in. It says I cannot start screen share while another participant is sharing. So if you could maybe stop your, thank you. All right, so Brown University, what are we all about here at Brown in this creative capital of Providence? Well, let's start with the numbers because that's always fun, right? So we have 14 research centers. I mean, we're just happy. Everybody here is happy that you've chosen public health, right? Because we're in the middle of many public health crises, and we need public health professionals more than we ever had before. So it's great that you're just choosing public health, no matter which school you end up attending or applying to. And each one is different and each one is great in its own way. And you'll find that out with my other presenters here. So 14 research centers, we specialize in a lot of things: gerontology, maternal and child health, mental health, addiction. We're top 8% in US News and World rankings. I'm about to introduce Meg from CUNY, who's ranked a little bit better than us. So just keeps on getting better and better along the line. We're top 10 in NIH funding, which is great. So that means you have more funding for your research. There's our beautiful building right there next to the water, that missing piece in our building. Well, that missing piece is you. Now I'm going to stop being cheesy, but we have a very low student to faculty ratio. This is kind of what sets us apart. You really get close mentorship with our faculty, so you can be successful professionally, academically, and personally. Learn public health by doing public health. This is our ethos. This is what we live by. This is essentially what it means. You'll be able to move freely from the classroom to the research centers into the community to make an impact while you're a student. Every resource that's available at Brown University is available to you, whether that's the Writing Center. We are one of the first schools to have an undocumented first-generation college and low-income center. Our career lab is amazing. Providence, Rhode Island, this is a really quirky, cool place. I didn't know what to expect when I moved here to Providence. I think the best way to describe it is cozy and cosmopolitan. It's got everything you would want in a big city, like awesome food, good culture, good theater, good art, but it's not overwhelming. It does sleep. So it's very walkable. I never had a car when I lived in Providence or Newport. Students get free public transportation as well. Walk score is 90. It's just a very, very cool, unpretentious place. Diversity and inclusion is so important at Brown. Brown is probably one of the most progressive, if not the most progressive, out of all the Ivy League institutions. We care most about, for our public health, we care most about vulnerable populations. So it's all about like reducing health disparities and health equity. Everything is seen through a lens of health equity. We have our own Office of Diversity and Inclusion within the school, where we have all kinds of really cool initiatives like LEAD. I really like LEAD. which is learning and engaging around diversity. We talk about things like medical mistrust or ableism, or like implicit versus explicit bias. I'm looking down, I see I have 1 minute and 36 seconds, so I'm gonna hustle. Master's programs, our biggest program, the MPH. Brown's great because you can really customize and personalize your education. So you're not just gonna be put on a track. We have 8 different concentrations, from mindfulness, addiction, maternal and child health, global health. You can do a thesis or an ILE. And then, of course, an internship. And then we also have online MPH, which is still open now, which is incredible, which is cool. And then an accelerated MPH for clinicians as well. Biostatistics, amazing. Data science is a super fast growing field. So it's a great field to get into if you love math, problem solving, analyzing, creating methods. This is a great program for you. Doctoral programs, what's great about our doctoral programs is that they're fully funded, 5 years guaranteed, fully funded. Career outcomes, we got 98% of our master's students have postgraduate plans within 12 months, 100% of our PhD grads do. So you're gonna be set up. Here are some examples of some of the places you can go: Amazon, Google, Shriners Hospital for Children, Rhode Island Department of Health. Admissions, everything goes through SOFAs, easy peasy. This is an ASPPH event, so you should probably know that. GRE is not required. Personal statement, differentiate yourself, reach out to our students. Our students are the best students in the universe. Yes, I'm biased. Everybody's going to say that here, but they're incredible, and they'll be able to give you a really good perspective on, what the culture is like here at Brown, what the relationships between faculty and students. So thank you so much. That is my alarm going off, and I will now pass things on over to Meg at CUNY. So let me just stop sharing and go right ahead. Take it away, Meg.
Thank you so much, Matthew. Okay, great. Share this. Okay, so my name is Meg Krutish. I'm the Director of Admissions at the CUNY School of Public Health. We are CUNY, and that's City University of New York, which has 26 different campuses in 5 different boroughs of New York City, and we are just one of them. We're a professional school. We're a graduate school only. Our campus is located at 125th Street, and you can see some really nice images of our campus. We have 5 floors in this building right here, really colorful, pretty new. We've been here only for 5 years. We are a graduate school and a professional school, as I mentioned, and so because of that, we're pretty small. We have 900 students total. About 600 of them, or 700 or so, are master's students, and the rest are certificate students or doctoral students. We offer the following graduate programs. So as I mentioned, we have PhD programs, doctoral programs. There are 3 of them, and they're in person. But most of our students pursue their Masters of Public Health and also Masters of Science. We have 5 Masters of Public Health concentrations. And the great thing is that we offer a lot of flexibility. So you can pursue your MPH degree either fully online, in person, or hybrid. It's really up to you of how you study and how you take your graduate education to the next level. We offer 4 Masters of Science degrees. Most of them are fully online, and 2 fully online graduate certificate programs. So this is a list of our doctoral degrees: community health and health policy, environmental and planetary health sciences, and epidemiology. And then our 5 Masters of Public Health concentrations are listed right here. You can apply to one or all of them at the same time, but you must choose which concentration you will be pursuing in the end. And our Masters of Science concentrations are listed right here. Again, most of them are fully online except our industrial hygiene degree. We do have 2 certificate programs. The great thing about the Advanced Certificate in Public Health is that if you are just not sure which MPH or MS concentration you want to pursue, you can do the certificate. You can take the 5 core courses that all master's students have to take, and then seamlessly transfer them into a master's program. And so you're not wasting any time, you're not wasting any money, but you're kind of gaining that basic understanding of public health, and then you have a choice of which master's degree to pursue, or you can stop just at the certificate as well. And then we also have this advanced certificate in industrial hygiene if that's your area of interest. As I've mentioned, we offer a very flexible scheduling for our students, and that is because CUNY students require that flexibility. Most of our students, 90% of them, are working during the day. Maybe they're working or they're taking care of family members. And so they need the flexibility to pursue their graduate studies on their own time. And so I've mentioned we offer these online programs, but students who want to come to campus and who just study better in person, they have a choice of coming in and maybe taking one course in person and one, online. If they do come to campus, those courses are offered in the evenings. So again, we are catering to these working professionals. And those courses are Monday through Thursday, anywhere from 5 or 6 p.m. to 10 p.m. And we allow our students to pursue their graduate career part-time or full-time, again, as their time allows them. So you can take anywhere from 1 to 5 courses per semester. The MPH degree is designed to be completed in 2 years, but if you pursue it part-time, it's going to take you a little bit longer, maybe 3 years, maybe 4 years. Our tuition is really quite affordable. We are a state school, and so our tuition depends on whether or not you're a New York State resident and also whether or not you're pursuing an online degree or that hybrid or in-person degree. And you can see here how affordable it is. Really, $620 per credit is really not that much at all, $26,000 for the entire degree. And a little bit more if you are an out-of-state resident, so you don't live in New York State. We do have some funding for our students, our master's students. We have these scholarships that offset a little bit of your tuition. They are quite competitive, but we are able to help a big proportion of our students with their tuition. We also have really good funding for our Masters of Science students in industrial hygiene. That's the environmental health program. Because there is just not enough of those professionals in the workforce. And so the government and various agencies provide these kinds of assistantships to them. Okay. The application process is pretty simple. As all schools of public health, we have students apply through SOFAS. And we are open right now for fall. We are still accepting applications for fall 2023. So that's rolling until August 1st. And I hope to see you in my breakout room. And next up, I would like to welcome Kent State University.
So it might help if we turned our camera and our mic on. So that's the kind of day I'm having. Sure, we've all had those days before. So good afternoon. My name is Jennifer Miller. I'm representing the College of Public Health at Kent State University. Definitely excited to be here today. So just wanted to share a little bit about our program. We are located in Kent, Ohio. So Kent, Ohio is in the northeast area of Ohio. You can see there's a lovely picture of our campus there. We do have all seasons in Ohio, so spring, summer, fall, and winter. I'm very passionate about that. We do have around 33,000 students across our 8-campus system. 116 students are represented in our student body, and we are an R1 designated research institution. Specifically looking at the College of Public Health, founded in 2010, we are only one of 2 accredited schools in the state of Ohio. We have around 333 MPH and MS students who are currently enrolled, and around 403 bachelor students and 40 doctoral students. Around 92% of our students do graduate within 2 years, and we do have 22 primary faculty enrolled. In addition, we also have a large number of adjuncts and folks who work in the profession. Just some general information about how our college works. We like to really focus on the whole student. We understand that students come with a variety of interests and passions and backgrounds, and we really work to leverage that for our students. We do offer tutoring support in some of our courses like biostatistics, so that support is there if you need it. We also do offer a writing center that's open to graduate students as well.
Jennifer, I'm so sorry to interrupt you, but you
Yeah.
may want to stop sharing and then share it again because we can't see the presentation.
Okay. Let's retry that.
That's
Better?
perfect. Now we see fostering student success.
Okay, great, thank you.
No worries.
So we do, oh, go ahead. Okay, so we do offer career guidance. We do have retired public health professionals that work to meet one-on-one with our students to provide opportunities for career advancement. And overall, the university does provide student support through what we call our Care Center, which helps students with emergency assistance and need. And the university and the college both do offer scholarships. And looking at our programs, we do offer a Master's of Public Health in 4 areas: biostatistics, epidemiology, health policy and management, and social and behavioral sciences. You can see on the screen, the programs with the computers are on 100% online, and with the buildings are 100% on ground. We also offer a Master of Science in Clinical Epidemiology, and we offer 3 stackable certificates in LGBTQ+ health, clinical research, and healthcare compliance. Our programs at the MPH level are 46 credit hours. On the screen, you can see the breakdown of how that 46 credit hours appears. Our MS is 36 credit hours, and you can see down below our tuition per credit. For in-state students, it's $695. Out-of-state students, $705 per credit hour. We are not a SOFA school. Students can go directly to kent.edu/apply. For our master's programs, students just need a 3.0, personal statement, resume, 3 letters of recommendation. We are GRE optional, but the TOEFL is required for international applicants. We're still accepting applications for summer, so if you're thinking about starting in summer, you do have a few more days. Our deadline is May 1st, and classes begin May 11th. Deadline for fall is July 1st, classes beginning August 21st, and in spring 24, November 1st. So we hope to see you in our breakout rooms. We will share additional contact information with you, but hope you have a great day, and hope you enjoy listening to the rest of the presenters. I'd like to turn it over now to Kayla from Tulane.
Thank you, Jennifer. Hi, everyone. My name is Kayla Magruder from Tulane University School of Public Health and Tropical Medicine, and I'm an admissions counselor here. So let's talk a little bit about Tulane. So Tulane School of Public Health and Tropical Medicine is located in downtown New Orleans on Canal Street. We're actually the first public health school in the country, founded in 1912 due to the yellow fever epidemic. We are CEF accredited, and due to the new U.S. News rankings for 2023, we were voted number 12 out of the public health schools, which is great. There are 7 departments here. We have the Department of Epidemiology, Biostatistics and Data Science, Environmental Health Sciences, International Health and Sustainable Development, Social Behavioral and Population Sciences, Health Policy and Management, and Tropical Medicine. Now, we have 7 departments and several programs within these departments. So we have both MPH degrees, MS degrees, Master in Public Health Tropical Medicine degrees, PhDs, and a DRPH program. And all of the programs that you see listed here are held in person, and the ones in light green in the bottom right are hosted online. And so some of those overlap, specifically in the Environmental Health Sciences department. So what's special about Tulane? So here at Tulane, we actually have a multi-layered advising model where our students have both faculty and staff advisors. So the faculty advisors are really designated to provide you with a little bit more career guidance, a little bit more field expertise, and based on their research and their previous experience and things like that, and your future career goals. Whereas your staff advisor is really put in place to help you navigate your time here at Tulane and to navigate the administrative processes and to keep you on track for your graduation and matriculation. We do have a very flexible curriculum. So no matter what program you're in, there's a set of 15 elective credit hours that you're allowed to take, within the university. But all of our graduate certificate programs are also about 15 credit hours, either 15 or less. So say you're getting your MPH in epidemiology, you could also simultaneously get a graduate certificate in tropical medicine or violence prevention, as an example. We do have study abroad options for several of our programs. This semester, actually, we had our first students attend a semester at the National Taiwan University. And as I said, we were the first public health school founded in this country. So you can imagine we have an extensive alumni network all over the country, but all over the world as well. Our alumni, our faculty members, even, they have research projects and jobs all over the entire world. So that's really awesome. And you can connect with them either via LinkedIn and other Tulane channels. And our graduate outcomes, we actually, as of this year, have a 99.7 placement rate for our graduates, whether that placement be in continuing their education in either a doctoral program or a postdoc program or actual job placement, which is great. We do have a holistic admissions review where everything that you submit to us will be considered for your admission. So we require official transcripts for all universities you have attended, a personal statement, and we have some prompts here to help probe you along for your personal statement, at least 2 letters of recommendation for our MPH and MS programs, and for our PhD and DRPH programs, we require 3 letters of recommendation, as well as a resume or CV. Now let's talk a little bit about deadlines. So we have both priority and final application deadlines, and priority deadlines just means to submit your application to be considered for funding. And the final deadline only guarantees application review. So for fall 2023, while we have passed our priority deadline of January 1st, we are still accepting applications through June 1st. Same for spring, summer, and fall 2024, as you can see those dates listed here. And for our PhDs, we only have 1 application deadline. So for fall 2023, that was this past December 1st, and for fall 2024, that is upcoming December 1st, 2023. We also host department virtual info sessions, where you can come for department-specific info sessions to get a little bit more information. Like I said, we have several departments here. We always like to connect you with our faculty members as well, which is never a problem. I'm running a little bit out of time, but you can scan this QR code in the right-hand corner to connect with our admissions staff anytime we host virtual office hours 4 times a week. If you scan this QR code, it'll take you directly to our Zoom page, the page on our website that has our Zoom links for our virtual office hours. And now I would like to pass it over to the University of Illinois at Chicago School of Public Health.
Hi, everyone. Just a second. Hi, so my name is Jake Wilson. I'm Assistant Director of Recruitment and Engagement for UIC School of Public Health. UIC is located, as you can see here from our campus photo, just a few train stops from the heart of downtown Chicago. It is located in the Illinois Medical District, which is the largest medical district in the country, meaning that kind of surrounding the School of Public Health is the entirety of the UI campus. Within a few blocks, there's the College of Dentistry, College of Pharmacy, 3 major hospitals, a VA, and the College of Nursing, all which we work with. At UIC, we focus on community engaged research with a focus on health disparities. So being in the city of Chicago, it is one of the most diverse cities in the country. So there is really not a shortage of public health issues to study. And a few years ago, we recently celebrated our 50th anniversary. So at UIC, we offer quite a few master's degrees. We have an MPH, an MS, as well as a Master's of Healthcare Administration. And then we also have PhDs and then a DRPH for more professional folks. All of these degrees are spread across our 4 academic divisions, which are community health sciences, environmental and occupational health sciences, epidemiology and biostatistics, which each have their own MPH and MS as well as PhDs, but they are just one singular division because they're just so closely married, as well as our health policy and administration, which includes our healthcare administrator degrees, as well as the informatics programs. So at UIC, we also have a great global health department. As I'd mentioned, in our 52nd year now as a School of Public Health, we have contacts all over the country, but all over the world in which students are allowed to do their research. That also ties into our applied practice experience, which is required for all of our master's students. It is practical training. So if you were going for, say, an epidemiology MPH or biostatistics, it might be more research focused, matching you with whatever your research interests are. But if it's healthcare administration or health policy, it might be more practical training. And those applied practice experiences prepare students for international careers in government, healthcare agencies, industry, and other academic institutions. So as I mentioned, Chicago is one of the most diverse cities in the country, and we believe that public health should be representative. So we are one of the most diverse schools of public health in the country. As far as affordability, we are also a top 10 in best value. And as I'd also mentioned, being part of the Illinois Medical District, you have access to all of the UI campus, health campus, and all of its resources at the School of Public Health. I took the 5 minutes to heart, and I feel like I sped through it accidentally, so I apologize. But once again, my name is Jake Wilson. My contact information is there. I will also be holding a breakout session that I hope to see you there. And now I will send it to the University of Kentucky.
Glenn, you're on mute.
Thank you. I thought I'd click the unmute button. Hello, everybody. My name is Glenn Means with the I'm the admissions and recruitment coordinator with the University of Kentucky. I'm going to share my screen real quick and let you learn a little bit more about our academic programs with the College of Public Health. So with the University of Kentucky College of Public Health, our vision is to be the catalyst of positive change for population health. Our mission is to develop health champions, conduct multidisciplinary research, and collaborate with partners to improve health in Kentucky and beyond. The goal of the UK College of Public Health is to develop care-ready population health experts. We do have 3 master's programs. Our Master's of Public Health, which has concentrations for epidemiology, health management and policy, health behavior, and environmental health. We also have a very competitive Masters of Health Administration program. And most recently, we just completed our first cohort of Masters of Science and Biostats. One you won't see listed here is our Masters in Epidemiology, which we just got approval for and will be launching in fall of 2024. We also have graduate certificates. These all mirror similar to what CUNY was mentioning with their programs of transferable credits if you want to dip your toe into public health. Improving healthcare value matches with our MHA program. Our biostats certificate matches with our biostats program. Our population health certificate mirrors with our MPH program. And then global health is its standalone certificate. UK College of Public Health was established in 2004. We are accredited. We're one of 6 health colleges on UK's campus. The college is deeply invested in our research. Our current president has a public health background, and our faculty received over $25 million for its projects in 2020. We are a small college with approximately 225 graduate students, as well as 250 undergraduate students. And we have a strong domestic and international alumni network. Student and academic life, about 90 new graduate students per year, 55 to 65 of those are MPH. That many of our graduate students are working part-time, as well as having 49 instructors teaching from 62 different courses, many across different campuses. And our student body is a very diverse student body. We also have 2 active student-run organizations within our MHA and our public health program. Benefits of the MPH program: we have a dedicated staff, private student lounge 24/7, lecture, research, and hands-on practice opportunities, and access to a comprehensive academic medical center, as well as close relationships across the state. Our MPH degree is very focused. It's designed to meet your needs, recent baccalaureate graduates planning careers in public health, or current public health and clinical practitioners. It is a 43 credit hour program with 4 concentrations, as I mentioned, and this is just a sample of a core curriculum that we can kind of go through in a little bit in our breakout session if you're interested. We also do have a fully online program within our health management and policy concentration. I won't go through these concentrations, I'll save them for the breakout, but we do have an environmental health concentration, an epidemiology concentration, a health behavior concentration, and our health management policy concentration, which I said is one of those that's considered fully online. The others are hybrid or more of an in-person concentration. We do have graduate certificates in biostats and global health, which we'll go through a little bit later. Most of those average between 12 to 15 credit hours. Again, with improving healthcare value and population health, with the population health certificate being available fully on 100% online. Paying for graduate school, we do have people in our second year MPH students that are teaching assistants, research assistants. So we do have funding opportunities as well as other scholarship opportunities for our public health grads to kind of be a part of and apply for. Living in Lexington, we're very much a small town. We have plenty of outdoor rec opportunities. We're less than 1 hour from world-class hiking, rock climbing. We are a horse racing capital of the world, so we would love to have you here to participate and go to Kingland and have some great opportunities there. We're ranked top 30 in the US and News Best Places to Live, so it's really a great place to live in a very, very cute small town. We do have graduate and family housing, which I'll go over a little bit if you're interested, if housing is a need for you. We are SOFIS, so if you need to apply, there's, we can go run through what those look like and what you need to kind of apply to our MPH program. And I'll save questions and answers for our breakout session, but we thank you so much for listening to the University of Kentucky kind of talk a little bit today about our programs. Last but not least, I want to turn it over to the University of Nebraska to kind of give their presentation.
All right, thank you very much. Thank you everyone for joining us today. I am Eric Brab. I am the recruitment and admission specialist with the University of Nebraska Medical Center's College of Public Health. So going into a little bit about our college, some quick facts. We're located in Omaha, Nebraska. Currently have in the College of Public Health just under 400 students with 77 faculty members. So current student faculty ratio is about 5 to 1. So that allows us to provide the one-on-one attention that our students want and need. And we have various programs we offer, from certificates, masters, dual degrees, and doctoral programs. And one thing also to mention, with our current 393 students, we're represented with our students represent 43 states and 22 countries. So we do have a pretty diverse student population. We have 5 departments within the College of Public Health: biostatistics, epidemiology, health service research administration, health promotion, environmental, agriculture, and occupational health. And we also have 7 centers for research and practice that you see there on the screen. The centers for research and practice allow our students to coordinate with our faculty on various projects that are going on throughout the college and within our community as well. Going into our academic programs, starting with our certificate programs, I'll offer 6 certificate programs that you see there. The certificates are between 12 and 18 credit hours, all can be completed in 1 year. All are directly transferable into our MPH program. And with our MPH program, 42 credit hour program with 7 concentrations. So the 42 credit hours broken up into, you've got 21 credit hours in your core public health classes, along with your applied practice experience and capstone, and then 21 credit hours in your concentration classes and electives. And with those electives, you can pick classes from other concentrations, because many of our students come in with multiple interests in the different concentrations. So you can kind of use those electives to gear that degree in the direction you want to go. Also offer multiple dual degree options in coordination with different colleges around the University of Nebraska system, as well as a couple of outside schools at Kansas City University and Marian University with their Doctor of Osteopathic Medicine programs. Nice thing about the dual degrees is you can work on both of the programs and typically complete those in a shorter amount of time. Other programs we have within the College of Public Health: Master of Health Administration program, Master of Science in Biostatistics, Doctor of Public Health with concentrations in epidemiology and emergency preparedness, and then 5 PhD programs. The PhD programs, those are fully funded programs with typically when we offer admittance into one of the PhD programs, it also comes with an offer of assistantships. Other programs can apply for assistantships. So there we do have master level students that have assistantships also, but with the PhD programs, that automatically comes with that funding. What I've highlighted here, these are all the programs we have that can be done 100% online. So all of our certificate programs, our Master of Science in Biostatistics, our MHA, the MPH program, and the DRPH program. Our online classes are asynchronous. There's not a set time you need to log into for a live lecture. Lectures are pre-recorded, so you can view those at your convenience. What I've highlighted here are the different application deadlines for our programs. The ones highlighted in green are the ones that are still open. So we're still, for fall, we're still accepting applications for our certificate programs, MPH, MHA, our MS in Biostatistics, and 2 of our PhD programs until June 1st. The typical admission requirements, we are a SOFAS school, so completion of SOFAS application, official transcripts from all previous schools, current copy of resume, CV. The GRE is optional for all of our programs except for 2 of the PhD programs, PhD in epidemiology and PhD in health service in policy research are the only 2 PhD programs that are still requiring the GRE. GRE for every other program is optional. Look for a personal statement of intent, and then letters of recommendation. Our certificate programs require 2. All other programs require 3. Current tuition for our programs. For on-campus, our professional programs, which is our MPH and certificates, you see the in-state and out-of-state tuition on those. Graduate programs, which is the MS in Biostatistics and the PhDs, the in-state and out-of-state tuition for on-campus. And then our online programs, we charge a flat rate. We don't differentiate between in-state and out-of-state, so it's a flat rate of $5.97 a credit hour for the online programs. So my contact information is there on the screen. I look forward to additional questions in our breakout sessions.
Thank you so much, Eric. We really appreciate it. We're now going to bring everybody on for a little general Q&A. If you have any questions, please put them in the question and answer feature on Zoom. But we'll wait for all of our panelists to turn their cameras on, and then we'll have a brief panel discussion, and then we will get into the breakout rooms in about 10 minutes. The first question is, and feel free anybody to offer their insight and opinions, what's the best way to prepare for your programs? Anybody at all? Let's try with Kayla. Kayla, what's the best way to prepare for your program?
By prepare for the program, do you mean prepare their applications or to actually prepare themselves to be students here at Tulane?
It was an audience question, so I'm not 100% sure exactly what they were referring to, but let's assume that they thought how to apply for, like, what's the best way to prepare for your specific program at Tulane?
Yeah, so I would say their personal statement is really important to prepare for our programs here. Our faculty for each department review your applications. So I would say to guide your personal statement for why you want to attend Tulane, why you want this degree from our school, and how that will help propel you for your career goals and your future. That's the biggest tip that I would give to prepare for your application here.
Awesome. Anybody else want to offer their insight before we move on to another question?
Yeah, I'll add something. That was a great answer, Kayla. Just be yourself, honestly. You know, it's so much less like, are you good enough for these schools? And it's so much more of like, are we good enough for you? Is it a good fit? Do we have the resources? Do we have the faculty connections? Do we have the research interests that you're looking for to be successful? Because you're the one that's going to be making an impact in public health, right? You guys are the ones that are going to be making the impact and changing the world and making the world a better place. So just be true to yourself. Do some soul searching, find out what you're truly passionate about, and then find what school fits your learning style and the culture that you want to be in. And then, however the chips fall, I'm sure you'll be successful no matter where you end up being.
Anybody else have any other tips? We do have some extra time for this Q&A. So if anybody has, Eric?
Yeah, one thing I like it, and just to piggyback, 100% agree. Be yourself. Interview schools as hard as they would be interviewing you, because it's got to be the right fit for you. We're kind of all in the same family. We're just trying to help produce the next generation of public health officials that hopefully have a strong enough voice if we run into our next pandemic that people will actually listen to. So I mean, we're all on the same team. But one thing that I always like to mention also, as far as strengthening your application with your letters of recommendation. When we ask someone to write a letter of recommendation for us and they say yes, we just assume they are going to write us a good letter of recommendation. I have actually seen on applications letters of recommendation come in where the person did not recommend them for the program. Why they agreed to write them a letter, I don't know why. It would just been better if they would have said no. But as you can imagine, if you have a letter of recommendation on your application where the person says, I have reservations, I don't know if they can do this, that really damages your application. So as you're talking to your recommenders, don't be afraid to ask them, are you able to write me a good letter of recommendation? Have a conversation with them. Make sure that they understand your passion about public health, why you want to do it. The more they understand why you want to do the program, they're kind of doing little check marks in their head. Yeah, I can see them doing this. It kind of helps guide your own letter, and you're just putting yourself in the best light. So I've seen it more than once where a recommender did not 100% recommend someone for the program. So just kind of have those conversations and try to kind of guide your application the best way you can.
Anybody else have any insight, or should we move? Oh, Jennifer?
Yeah, so I was just going to say a lot of students are nervous about approaching the folks that you see on the screen who work in graduate admissions. So please don't be afraid. We're just normal people. We understand that you have questions, you're comparing schools. This is a really great opportunity for you to connect with us and to ask those questions, because sometimes it's hard to find things on websites. It's hard to find an apples to apples comparison, and just really emailing or talking to someone sometimes is all you need to reassure yourself. So take advantage of those resources that you have.
That's really good advice. I'm also just going to put something in the chat. We have an academic program finder where you can filter on specific things. So if you're trying to prepare for your program, figuring out what you're interested in is really helpful, and seeing what schools offer that specific concentration. And then I also put in a link for an area of study, because I meet a lot of students who are coming out of their undergraduate and they're like, I'm interested in public health, but I'm not quite sure what concentration to go in. So I put some resources there in the chat. Our next question is for people who want to know the difference between a certificate program and a degree program. What is a certificate program, and what is the difference from like a degree program? Some of our international students aren't really familiar with that type of terminology.
So I'll start. So the word certificate is going to differ based on how institutions kind of classify that. So it can state a certificate, a graduate certificate, can be between 9 and 18 credit hours. And it's going to be focused on a specific area. So a certificate gives a student an opportunity to focus in a different area. I kind of liken it to a minor. So as an undergraduate student, maybe you pursued a minor, maybe you added another area to differentiate yourself as you approached your next steps. That's what a certificate does, is it gives you that differentiation, typically, 9 to 12 to 18 credit hours, so significantly less than maybe a 43 or 46 hour master's program.
Anyone else want to add to that thought, Meg?
Yeah, I'd just like to mention that in a lot of cases, when students are considering a certificate versus a master's program, and they're looking at how much it costs, financial aid is not necessarily always available for certificate programs, especially federal financial aid, if you're trying to use, loans to pay for your graduate tuition, whereas a master's degree is. So just make sure that you check with the school that you're applying to, whether or not funding is available for certificate programs.
Anyone else before we move on to the next question? Okay. The next question is, if you want to obtain a dual degree program, is it possible to complete the MPH portion first, or is it required to be completed later?
I can hop in. For all of our dual degrees, they're kind of a choose your own adventure novel. There's really any way you can do it, but I would say the lion's share of our students, like for our MBA MPH or our MSW MPH, a lot of times for the MBA MPH, for a lot of these dual degrees, there might just be, unfortunately, a better degree suited for you. So for our MBA MPH, for example, that's really just our Masters of Healthcare Administration. So that's kind of taking that 3-year dual degree and really condensing it down to just 2 years for the MHA. Or for the Masters of Social Work and MPH, we work very closely with our Jane Addams College of Social Work, where we can design a lot of our MPH courses. We have a ton of elective hours, and that gives students the ability to take courses that maybe are outside of the School of Public Health to really, shift their or make their MPH their own. So instead of getting a full dual degree, you can just take social work courses as your elective hours. One of our more recent epidemiology MPH students actually was interested in intimate partner violence, and we're studying that. So instead of doing the complete MSW MPH, they were just doing the MPH, but almost all of their elective hours and all of their research was done inside the College of Social Work. That being said, now for the actual question, I guess, instead of just meandering around, it's kind of like I said, it's a choose. Most students start in one degree program, and then after completing about 1.5 years or 2, then finish the other degree program. Whether it is the MPH or the MBA or whichever it is really up to the individual. But we really do tell students to really think about dual degrees. Just because once you're put in that, as far as UIC is concerned, into a dual degree program, you have to complete both degrees to actually get your diploma. So we have had quite a few students that, sign up for the MBA, MPH, halfway through their MBA, decide that maybe that's where they want to focus, and then have to jump through a bunch of, kind of registration hoops to get that removed. So for us, you can add a dual degree at any point until your last semester. So usually when students are applying to the dual degree, we suggest kind of start talking to your advisors, start really formulating what you want to do in the long run. And then you can add that dual degree at any point. And the nice thing is with all of our dual degree programs too, is a lot of the elective hours kind of then double dip. And that's why it's only, 3 years to do it. So you really aren't starting taking those elective hours till your second year. So you kind of have that time to really decide if that's what you really want to do.
That was a really thorough answer. Thank you, Jake. That was wonderful. Anybody else have anything to add about that specific question? No one. Okay. The next question, and it's a multiple parter. So we'll start with the first one. For most of you, are applications open right now for 2023? Okay. And their deadlines are on their website.
I should say no for us.
No for UIC. Okay.
If it's an MPH domestic, you'd have to reach out to the program to request a late application, but most of our application deadlines were April 15th. And only, I think, 3 of our programs have spring deadlines. It's only fall for us.
the next part of the question is, do all of you have a place on your website for scholarship opportunities? Another resource I will send everybody is, we have a finance degree website on our, and I'll put that in the chat. And then the last question is, if somebody has public health experience for 8 years and an international student and they're finishing their thesis on an MS, would your advice be to apply for a DRPH or PhD or an MPH? I know that's kind of specific, and we're trying to ask people to ask specific questions in the breakout rooms. But I think that we do get this question a lot, is if I have a lot of experience, if I'm already have my master's degree, what is the next step in my process? So I did think that this was valuable to see what your opinions are about it.
So,
Sorry, I'll make mine quick because I know I just talked for a while, so I don't want to go too long. For us specifically, it's what you really want to do. Our PhDs are research degrees and our DRPH are professional degrees. Our DRPH requires at least 3 to 5 years of managerial or leadership experience in public health or a related field. So really the DRPH would be used to advance your career you're already in, where the PhD is more of a research degree to prepare you for research, academia, or to kind of get into a career, where the DRPH is more of a mid-level career degree.
I was gonna say almost the exact same thing. Our PhDs are research degrees, and our DRPH is specifically designed for leadership, advocacy, and equity. So if you're getting your MS and your thesis is in research and your background is in research and you want to continue doing research, then I would recommend a PhD. But if you want to go more of the leadership, advocacy, and equity route, then I'd recommend a DRPH.
So it can state all of our programs are PhDs, but I would strongly encourage you, regardless of what option you consider, to look at the faculty who comprise each school and program to identify folks that you're interested in working with or who have similar research interest areas who align with what you're passionate about. That's going to be really a critical piece of the puzzle.
I was just going to add to that a little bit. I think this question, of course, is very specific, but it's a good question. And that's why I encourage all students to kind of look at each university and what doctoral programs that they have, just because they could be very specific. I know some public health doctoral programs, like some people are mentioning, are professional. Some are just doctoral programs. So it's very interesting when you look at the different programs, which ones are more practice-based, which ones are more research-based. I know at our school, we offer a doctoral program in health services research. So that one is very specific to health services research. We're getting ready to launch a public health doctoral program in fall of 2024, which we had in the past, but we're looking to go more of a professional route with our public health doctoral program and a doctoral program in EpiBio. So I just encourage all students who are on the call just to kind of research those doctoral programs, because depending upon the specifications or that research focus, it's just important to kind of know what you're applying for so you apply to the right path.
Thank you. We have a few minutes left, so why don't we do one more question? And this is just general advice for a student to be successful at your school. Once they're already in, like, what's general advice that you have for somebody to be successful, to manage burnout? Obviously, with the pandemic and everything, we're all a little bit, I think it's harder to cope for some people, me being one of those people. So I think that having some tools and tricks in your toolbox to be able to help you navigate burnout is really valuable for students. So do any of you have any advice to be successful at your institutions?
I do. So our Student Government Association here on campus, they actually host events every single week on campus for our on-ground students. They're supposed to actually start some virtual events for our online students this upcoming fall. I'm not sure exactly what those are just yet, but every single week we host Zumba, yoga classes. They even offer some meditation hours. We always highly recommend self-care. We also offer free counseling services for all of our students. We call it CAPS. Just with anybody that's struggling, that's available for both of our on ground as well as our online students. They're able to utilize our free counseling services. So yeah, there's a host of different things. And if you come to our breakout room, we can chat about it a little bit more. Our Student Government Association have their entire own social media page. So you can look at that and just see the different types of events they host every single week. But we just try to keep our students as involved as possible.
No.
I'll jump in. I think to be successful in our programs, it's just very important to keep an open mind. It's okay if your concentration, once you're in the particular program, if you are hesitant and you're like, actually, I'm interested in health management and not epidemiology anymore. That's okay. We want you to be successful. We want you to be successful in the concentration that's going to make you the best public health champion, for each of your colleges, whichever college you decide to go to. But one thing I've noticed when I've been working with students is a lack of being engaged in research opportunities. And so I just want to kind of make that a point. A lot of students forget that is even an option or how to go about being involved in research. And I just think it's very important in order to further what we're doing as public health professionals that we engage students in that kind of research realm. Research is very important to what we do. And in order to be a successful student, you're going to, touch many different places where there are research opportunities. So I just encourage you as a student to be successful. Make sure you engage those faculty members, engage people on your campus in those research opportunities, because you never know where your name might end up in a publication with assisting with a faculty member, which is very important for a successful public health career.
Yeah, and I'll piggyback off of what Glenn and Kayla said as well. And I'm sure all these institutions are like this. Brown is a very collaboratory space. So everybody wants to see you be successful. You have a lot of support. You have a lot of advising. You have your own mentors. You have your mentor groups. Fellow students want to see you successful, alumni. So there's a lot of support for you. And like Kayla mentioned, we all have, CAPS and counseling, psychological services, and we have our own mindfulness center here at Brown. So there's a lot. You just have to just reach out, just don't be shy and make sure to communicate if you need help. And there's a lot of people here to support you.
Yeah, and to go off that, we also have a wellness center as well. Obviously, probably not shocking to most people here, but in this field of public health, most of us are, very mindful of mental health and its importance. One of the things for Chicago and UIC specifically, a lot of our degrees are very cohorted. So a lot of the, core courses that you'll be taking it with students, maybe from an epidemiology MPH or health policy MS, and it's kind of then you kind of get this own kind of support structure in there. The other thing about Chicago is a pretty transient city. Me included, most of my close friends are not native Chicagoans. So it kind of also has that, a lot of outsiders coming together and kind of making this place their home. So there's also that support structure there too.
Awesome. Thank you all for your insight. We really appreciate all of your presentations today.